Imagine this. You've just stepped into an oncologist's office for the very first time. It's a profound, disorienting feeling, isn't it?
Oh, absolutely.
Like you're crossing a threshold into this, I don't know, new country with its own strange language, its own kind of unforgiving landscape.
Yeah.
There's fear, there's anxiety, and just this desperate, overwhelming need for a clear map, some idea of where to go next, how to protect your loved one.
That feeling is not only valid, it's pretty much universal. But here's the core truth we want you to hold on to right from the start of this deep dive.
Wow.
You, the caregiver, you are not just a passive observer in this.
Right.
You are an essential, active, and actually profoundly powerful member of the care team. Your voice, your intimate knowledge of your loved one, and crucially, asking the right questions. Those are the most effective tools you have to shape this entire cancer journey for the better.
Exactly. And that's precisely what this deep dive is all about. We're not just handing you a list. We're really trying to arm you with a mindset. We're digging into critical excerpts from Essential Questions for Oncology Caregivers, a guide that, well, it helps transform those overwhelming moments into strategic opportunities.
Yeah, our mission today is really to equip you with that clear map and those powerful tools so you can navigate this complex landscape. We want to help you turn those potentially daunting appointments into productive, empowering strategy sessions. And we'll really focus on the impact of asking the right questions, especially in geriatric oncology.
Oh, okay.
Because there, preserving the whole person you know, their independence, their unique quality of life, their personal wishes, that's often just as critical, maybe even more so, than simply treating the cancer itself.
Okay, let's unpack this then.
Yeah.
Because the clinical environment, well, we know it can be incredibly fast-paced and, let's be honest, pretty intimidating.
It really can be.
It's so easy to walk out feeling like you've forgotten every single question you carefully planned to ask. So how do we make sure we're not just, physically present, but genuinely effective partners in this really important process?
Well, it starts with understanding this concept of shared decision-making. That's really at the heart of modern patient-centered care.
Okay.
It means you, your loved one, and the medical team, you all actively work together. It's sort of a collaborative dance, balancing the latest clinical data with something just as vital, what matters most to the patient.
Right, their values.
Exactly, their values, their life goals, their preferences for how they want to live, even while getting treatment. And to be an effective partner in that, to really have your voice heard and, integrated, preparation is absolutely non-negotiable.
Preparation, that's a powerful word here. Our source gives us some really insightful practical strategies for preparing. And it's more than just ticking boxes, right? It's about kind of shifting the dynamic.
Definitely.
First off, write it down. Why is this so crucial beyond just, memory going blank?
Well, it's multi-layered. Yes, your mind will go blank under stress. That's just human physiology. But writing your questions down does more than just help your memory. It subtly communicates to the medical team that you're organized, you're serious, and you expect clear, considered answers. It actually changes the perceived dynamic. You're not just a worried relative, you're an informed advocate with specific things you need to know. And that often leads to more comprehensive responses. It can empower you to steer the conversation, making sure your key issues get addressed. Think of your list like your personal agenda for the meeting.
I like that. Your agenda. Okay, another brilliant strategy. Bring a partner and define roles.
Yeah.
Why are two always better than one in these situations?
Well, 2 sets of ears are always better, for one thing. And 2 brains process information differently.
True.
One person might catch a crucial detail about, say, medication dosage, while the other picks up on the doctor's hesitation or a nuance in how they explain something. And defining roles is key because it stops you both from getting overwhelmed. Maybe one person is mainly there for emotional support, for your loved one holding a hand, offering reassurance. The other becomes the designated scribe, focused on taking detailed notes, documenting answers, tracking the next steps. That division of labor lets each person focus, so you capture more, and it's less stressful.
And speaking of capturing info, what about asking to record the conversation? Is that really okay?
Absolutely. It's becoming much more common, and it's perfectly acceptable. Just ask, do you mind if I record our conversation on my phone?
Okay.
Most doctors actually welcome it because they get how much information is being thrown at you. A recording lets you review details later without the pressure of the moment. And critically, it lets you share accurate info with other family members who couldn't be there. It's invaluable, really.
Okay, so you've got all these questions written down, maybe even recording. But appointments are often rushed. How do you stop that long list from becoming overwhelming in the moment?
You prioritize. That's key. Don't let a huge list paralyze you. Before you walk in, circle the top 3 to 5 questions you absolutely need answered.
The must-haves.
Exactly. Lead with those. Get clarity on what matters most first, for your peace of mind and your loved one's immediate needs. Then, if there's time, you can get into the secondary questions. It ensures your biggest concerns get addressed, even if things run short.
And then there's the medical language. It feels like a whole new dialect sometimes.
It really does.
You mentioned becoming a jargon buster. What's the power in politely interrupting to ask for clarification?
Oh, it's vital. If the doctor uses a term you don't understand, like metastasis or palliative or performance status, anything, you must politely interrupt.
Even if it feels awkward.
Especially then. A simple, "I'm sorry, doctor, could you please explain that in simpler terms?" Or even, "Could you explain that like you were talking to me at my kitchen table?" That's incredibly powerful.
Okay.
The hidden power is twofold. First, you're your loved one's advocate and interpreter, making sure you both understand. Second, it often prompts the medical team to use clearer language for the rest of the chat, which helps everyone. Never feel embarrassed to ask. It's your right.
That's good advice. Okay, here's another practical one. Feels almost like a scientific observation. Document the baseline. Why is understanding your loved one's normal so critical before treatment starts?
Because changes, especially subtle ones, can be really important signs either of side effects or maybe how well the treatment is working. Before treatment starts, take detailed notes on their normal. What's their energy level, maybe 1 to 10, typical appetite, how far can they walk comfortably, normal sleep patterns. This gives you concrete data.
Right, not just, they seem tired.
Exactly. Instead of he's tired, you can say, look, last month he could walk to the mailbox and back fine. Now, after 2 rounds of chemo, he can only make it to the end of the driveway and needs to rest. That's specific, actionable information. It can really influence treatment adjustments. It turns vague feelings into actual evidence.
That makes so much sense. And finally, before you leave that appointment, there's one question you should never, ever forget.
Never leave without knowing your next step. Always ask, what is the immediate next step? And who is the best person to contact if we have questions between appointments?
Okay.
Get a specific name and a direct number, maybe a nurse navigator, clinical coordinator, or a specific nurse on the team. These people are your absolute lifeline. They help navigate the system, answer questions, give guidance when you're not right there in the office. Don't just rely on the general office number.
These preparation steps, they seem simple, but like you said, they really transform those confusing, maybe anxiety-inducing appointments into productive, empowering strategy sessions. Put you in the driver's seat.
They absolutely do. They shift you from feeling like a passenger to being an active co-pilot in this.
Okay, so now that we've armed ourselves with that crucial toolkit of preparation strategies, let's shift focus. Let's talk about deciphering the diagnosis itself. This is the bedrock, right? Everything else rests on this.
Exactly. These are the foundational questions. They establish your basic knowledge about what you're actually facing. Without this clarity, making informed decisions later, well, it's not just difficult, it's nearly impossible. It helps you understand the battlefield, so to speak.
So let's dive into some key questions here. First, the straightforward one. What specific type of cancer does my loved one have? But then, how do we get a clearer picture of its spread, its severity?
That leads right to the next critical question. Where did the cancer start, and has it spread to other parts of the body? This is how you understand the stage of the cancer.
The stage, yeah.
The stage describes its original location, its size, and how far it might have spread. Understanding the stage is paramount because it profoundly influences treatment options and the overall prognosis. It's like knowing how big the fire is and if it's contained.
Right, and what about understanding the pathology report? We often hear terms like grade, which we ask about that.
You should definitely ask, can you explain the pathology report? What does the grade of the cancer mean? The grade describes how abnormal the cancer cells look under a microscope compared to normal cells.
Okay.
And it often suggests how quickly they might grow and spread. A higher grade often means a more aggressive cancer. Understanding the grade isn't just jargon. It dictates the urgency and maybe the aggressiveness of the treatment plan. It helps you mentally prepare for the pace of things. It tells you the speed of the disease.
And to get the full picture, what about further tests?
Yeah, you'll want to know what further tests are needed to understand the full picture. This might involve a whole battery of things. CT scans, PT scans, biopsies, maybe an MRI, specialized blood work. Each test gives a piece of the puzzle, so it's important to understand why each one is being done and what info it should provide.
And then the question everyone kind of dreads, but it's vital for planning. What is the prognosis? How do we frame that difficult question?
It's never easy, but it's crucial for setting realistic expectations and making informed choices about quality of life. The source wisely suggests framing it like, what is the typical outlook for someone in this situation? Or maybe, what are the best and worst case scenarios we should be prepared for, considering everything?
Right.
It allows the medical team to give an honest assessment without feeling pressured to give, false hope. It helps you understand the journey's potential length and challenges.
Okay, now here's where it gets really insightful, I think. Shifting to treatment goals and options, especially through that critical lens of a geriatric perspective.
Yeah.
For older adults, the decision-making gets much more nuanced, doesn't it?
Absolutely. What's fascinating here is that for older adults, the best treatment isn't automatically the most aggressive one. It's rarely one size fits all.
Right.
The goal for a geriatric oncologist becomes this delicate, highly personalized balance. Yes, fight the cancer, but also meticulously manage any other existing health issues, and critically safeguard the patient's overall quality of life and independence. The ideal plan deeply honors the loved one's personal goals and what they truly value. For some, it might be extending life at all costs. For others, maybe it's maintaining cherished activities or avoiding really severe side effects.
That distinction is incredibly important. So, what questions help define those treatment goals right from the get-go?
Well, the very first question should be, what is the primary goal of the treatment you're recommending? It forces clarity.
Okay.
Is the goal to cure the cancer? Is it to control it, extend life, manage its progression? Or is it mainly to manage symptoms and prioritize comfort and quality of life, what we often call palliative care? The source reminds us that all of those are valid, noble goals. Understanding which one is primary shapes the entire path.
And what about just knowing all the choices available?
Then you need the full landscape. What are all of the treatment options available? This could be surgery, chemo, radiation, immunotherapy, targeted therapy, even active surveillance or watchful waiting, where you monitor without immediate intervention. You need the whole menu to really engage in that shared decision-making.
And then, tying it back to that geriatric perspective, what question helps tailor the recommendations specifically to the older adult?
This is where you get specific. Why are you recommending this particular treatment plan for my loved one, considering their age, their other health conditions, and maybe their personal preferences we discussed?
Right.
This makes the doctor articulate the why based on your loved one's unique situation, not just a generic protocol.
And naturally, you have to understand the potential downsides.
Exactly. What are the potential benefits and risks of this treatment? And don't settle for vague answers. Try to get specifics like, what's the rough percentage chance of the cancer shrinking versus the chance of a serious side effect needing hospitalization?
Right, getting concrete.
Yes.
Yeah.
And crucially, don't forget to ask, how will this treatment affect their other medical conditions like heart disease, diabetes, kidney function, and the medications they already take? This is huge and often overlooked. Some cancer treatments can worsen existing conditions or interact badly with current meds.
This sounds like where the geriatric assessment comes in. It sounds like it's about much more than just the cancer itself.
It absolutely is. The geriatric assessment is really highlighted as the cornerstone of modern geriatric cancer care. It's not just about the tumor, it's a comprehensive, multidimensional look at the older adult's overall health.
Like why?
It includes assessing memory, cognitive function, their physical function, mobility, nutrition, social support, even psychological well-being. It creates this holistic picture of your loved one's resilience. And crucially, it helps predict their tolerance to various treatments much more accurately.
Can you give an example?
Sure. Say the assessment finds mild cognitive impairment. That might prompt the team to choose a treatment schedule with fewer, shorter appointments to reduce confusion, or maybe opt for oral meds instead of IV drips to maintain a sense of control at home. It fundamentally changes the how of the care plan.
Okay, that makes sense. So given that comprehensive assessment, what about treatment intensity? Are there other paths to consider?
It leads to critical questions like, are there less aggressive or maybe lower dose treatment options we could look at? Could they offer a similar benefit with fewer side effects, preserving quality of life? And then a really tough but necessary question is, what would happen if we changed not to pursue active cancer-directed treatment right now? What would a plan focused purely on comfort and symptom management look like? This isn't about giving up. It's about understanding all the paths so you can make a choice that aligns with the patient's deepest wishes.
Okay, so shifting again, what does all this mean for just daily life, for preserving quality of life? Because this is where you, the caregiver, are the world's leading expert.
Precisely. Your intimate knowledge is invaluable here. You know what makes their life meaningful, what their days actually look like.
Yeah.
These next questions are designed to protect that meaning, to make sure that trying to treat the cancer doesn't unintentionally wreck what your loved one cherishes most. You're the expert on their normal and how treatment might mess with it.
So let's get into those questions about the real-world impact. First, what are the most common side effects, and how can we proactively manage them at home? What should caregivers ask about beyond just, say, nausea?
Right, don't just ask about nausea, which everyone expects. Ask about debilitating fatigue. It's often much worse than just being tired.
Okay.
Ask about appetite loss, pain, skin changes, and really importantly, cognitive changes, that chemo brain thing affecting memory and focus. Understanding these up front lets you prepare, maybe stock up on things you'll need, adjust expectations. It's about building a coping strategy before it hits.
And how will treatment realistically affect their day-to-day independence? This seems crucial.
Be incredibly specific here. How will treatment realistically affect their ability to drive, cook meals, manage finances, bathe themselves, walk around the house, enjoy their hobbies like gardening or reading?
Really concrete things.
Yes. That specificity helps the medical team grasp the real-world impact. It might even lead to referrals for occupational therapy or other supports to help maintain as much independence as possible. It paints a picture of their actual life.
And speaking of support, what specialists can help specifically with quality of life?
You should explicitly ask what specialists can help us preserve quality of life through this. Think about a palliative care doctor for expert symptom management right from the start.
We'll come back to that.
Yes. Also, a nutritionist for appetite issues and strength, a physical therapist for mobility and preventing falls, maybe an occupational therapist for adaptations at home. These are often overlooked but vital team members.
And what about mood, memory, thinking?
Oh.
That's a huge worry for people.
It is, and you need to ask directly.
Yeah.
How might treatment affect their mood, memory, and thinking? And what can we do to mitigate this? Cancer and its treatments can cause anxiety, depression, cognitive fog. Knowing this upfront means you can seek mental health support or use strategies to help maintain cognitive function.
And for you, the caregiver, asking about the time commitment. Why is that so critical for avoiding burnout?
Oh, it's absolutely critical for you. What is the expected time commitment for treatment? How many days a week are appointments? How many hours each time? And roughly how many months will this go on?
Right.
This is essential for you to manage your own work, family, everything else, and prevent that overwhelming caregiver burnout. Knowing the time commitment lets you plan for breaks, maybe delegate tasks, build your own support system.
Okay, last big category, logistics and support systems. Because, let's face it, navigating the healthcare system itself is often a parallel struggle, right? It can feel like a maze.
It absolutely can, like a second full-time job sometimes.
So what does this mean for building your support network and just making that process smoother?
It's really about establishing clear lines of communication and knowing exactly who to call, day or night. Key logistical questions include, who is our main point of contact on the care team? As we said, often a nurse practitioner, a PA, or a nurse navigator. That person is your go-to for most non-emergency questions.
And for emergencies or off hours?
You need to distinguish clearly. Who should we call during the day with non-emergency questions? And really important, who do we call at night or on weekends if a serious problem comes up or we need urgent advice?
Okay, and knowing when to call versus when to go to the ER.
Yes, get a clear written list of what specific symptoms should make us call the office immediately versus going straight to the emergency room. You know, is a low-grade fever a call-us thing or an ER now thing? Getting that clarity saves time and prevents a lot of anxiety.
And finally, what about support services within the hospital or clinic?
Yes, definitely ask, are there support services available right here? Specifically ask about social workers. They can be invaluable, connecting you with resources like home aid, transport, financial counselors for billing nightmares, and support groups for both patients and caregivers. They're often hidden gems.
And here's where we hit that common misconception you mentioned earlier. Something our source really stresses is vital to understand.
Yes, it's this widespread and frankly damaging myth that palliative care is only for the very end of life when nothing else can be done.
Right, like it means giving up.
Exactly. But what's truly transformative about modern oncology is understanding that palliative care is specialized medical care focused on relief from symptoms and stress of a serious illness. And it can and should be provided alongside curative or life-prolonging treatment right from diagnosis.
From day one.
From day one. It's about optimizing quality of life, managing pain, fatigue, nausea, emotional distress while you're getting active cancer treatment. So you should absolutely ask, can we get connected with the palliative care team? They can make a huge difference in managing symptoms and improving overall well-being throughout the journey, not just at the end.
Wow. This has been such a comprehensive deep dive. It's so much more than just a list of questions, isn't it? To bring it all together, it's important to remember, like you said, this is a marathon, not a sprint. These first appointments, when you're armed with these proactive strategies and informed questions, they're about gathering intelligence, building strong alliances with the care team, and really establishing your role as a confident, informed, and genuinely empowered advocate for your loved one.
And that's the empowering message from our source we really want you to take away. You are your loved one's anchor in this storm, and by asking these questions, you are actively helping steer them toward the safest possible harbor, one that respects their dignity, their wishes, their quality of life. You can do this. You are essential.
Indeed. You really do have the power to profoundly shape this journey. So here's a final provocative thought for you, the listener, to consider on your own journey. How does this proactive question-asking approach fundamentally change the whole dynamic of the patient-caregiver-doctor relationship over the long term? Moving beyond just getting answers to building a true, enduring partnership in care, something to mull over as you navigate the path ahead.